she call?
He's got to wing it, girlfriend. Okay, I'm Dr. X, and I'm asking you, why should I use Summit?
Why should you use Summit?
Why are our compounds better than anybody else? Ingredients, customizing therapeutic interchanges.
Oh, well, so you know what? I'll just talk about this. I don't know if we want to put it on the website. So when I start talking, people will ask questions, well, what about Summit? So Summit is a workers' comp and motor vehicle pharmacy nationwide. We have been involved in veterinary compounding in the past. We got out of that market, concentrated specifically on workers' comp and motor vehicle. There was a trend where compounding came back. There's also the trend where the DEA is wanting better options for opioid abuse. We have taken our experience with motor vehicle and workers' comp and the use of opioids and started doing compounding so that we give doctors other options to the opioid use.
Also, try to focus right on here on this one.
Okay.
Right above the lens here.
Okay, so should I start over again?
You're sounding great.
Yes.
I'm just nervous.
It's going up out of the.
I'm like, because I'm nervous.
So Neil, you need to do is just like sit here, put your chin right here, like, are you back in?
Okay, so should I start over again?
Yeah, I mean, if you just summarize exactly what you just said, I think you'll
Okay. So Summit Pharmacy is a workers' comp and motor vehicle pharmacy nationwide. We help the physicians and attorneys manage the claims for the patients while the claims could possibly go into litigation while they're waiting for prior authorizations. Summit Pharmacy will stop. I am not good at this. This is not my cup of tea.
You're doing great.
You're doing great.
I've seen you're doing years beyond a lot of people.
Okay, I'll regroup here in a second.
I was going to say, you want me to stand back? I'm just trying to watch the door so nobody like
Right.
Otherwise, I can stand back here and be like you're talking to me.
Mm-hmm. I'm trying to, because when I'm up there talking, it's much easier than sitting here trying to, because people have posed questions to me, and then I'm
You're right on it.
I'm on it, because, yeah, I'm on it. I can do that. Okay, so let's regroup. Summit Pharmacy is a workers' comp and motor vehicle pharmacy nationwide. We help the physicians and attorneys manage the claim while the claim could be in litigation. It could be, the medications could be requiring prior authorizations. I don't like that. See, I just don't like what I'm saying. Hold on, I'm thinking. What do I say? Yeah.
Maybe you could just say something about when I'm in the field.
Mm-hmm.
It's okay to write me in the field, or is that bad to say since you're a pig?
Yeah, I probably shouldn't say that.
I'm answering questions, because people could be calling you.
Mm-hmm.
You know, when I'm speaking with physicians and answering questions, and do you have any like FAQs, frequently asked questions? You know, like why should I use compounding? Why do you use these ingredients?
Right.
Something like that, maybe.
See, I usually talk about how we started doing compound not because it was a new trend in the market. It is options for the doctors for opioid use. Okay, so when I'm discussing options with physicians, I like to give them the option of compounding. With the trends in the marketplace, the DEA wanting to decrease the abuse of opioids, compounding is definitely a viable option. We are able to work with the doctors, find compounds to treat the patients, and be able to hopefully help assist the doctors decrease in the amount of opioid use. The decrease of opioid use in the marketplace and with the patients will allow the patients to go back to work, will allow them to be able to function with their family. They can use the compounds during the day and then go back in the evening to use the opioids when their pain level has increased. Think of the questions. Okay. Many of the physicians, no. I can't do this. This is not my cup of tea. I would not be a politician. Let's see. So with the scar creams, the base that the scar cream is in is called Practisil. Practisil has studies that have proven to decrease the raised, elevated keloid area along with decreasing the color. When you add different active ingredients into the base, then it also helps with the keloid. Example, betamethasone is used, it's a corticosteroid that is used to decrease inflammation, to flatten the area. It will flatten the keloid, it will also take out some of the discoloration. We also have a scar prevention, which can also be used for stretch marks. This is safe to use during pregnancy, and you usually see results within 4 to 6 weeks. The patients, though, could use it up to 12 weeks and then stop the medication. If they need further therapy after evaluation for a month, then you could restart the medication up and it would be safe for use.
I think answer questions that you are a pharmacist. If someone's asking you for that, that's perfect. You're talking about the keloids and the betamethasone, you know, it's almost like,
What you know,
Yeah.
and even
Yeah.
like, even think of our whole compound ingredient description, the topicals. Do you know what I mean? I mean, you know a lot of those, but even to say, you know, what
Right.
frequently used ingredient, you know, for ortho is,
Right.
or HRT or anything.
Okay, let me try to think. On bioidentical hormone compounding, on bioidentical hormone compounding, we think of individuals who are going through possibly menopause or going through changes in their life. Bioidentical hormones can also be used to help to heal. So if the doctor is doing vaginal reconstruction, they can use estrogen mixed with tramadol. It can be inserted vaginally. So then you're getting direct healing from the estrogen being inserted along with the pain control from the tramadol.
You're not gonna have this big lengthy like he is. You're gonna be like, for this, we like this, for, you know.
Yeah, I'm trying to think of other things.
What about Dr. Axe? Think about things you talk about with Dr. Axe.
Oh, I know. Okay. As far as compounding with anti-inflammatories, so there is diclofenac, ketoprofen, flubiprofen. Those are the main ones that are used in compounding practice. Ketoprofen is a crystal opposed to a powder. So when you mix it into a compound, you have to use additional wetting agents. With that being said, because it's a crystal and you wet it down, it can become sticky. Also with compounds going above 35% active ingredients, you have the problem of them becoming sticky. In the marketplace, the trends that we've seen, doctors seem to prefer the diclofenac, not because it's necessarily a better active ingredient, but because it is not sticky. Patients don't complain of their shirt sticking when they've used a ketoprofen at 10% or 20%. There you go. See, those are the questions. What are other things, Joel? Yes, I just talked about that. I didn't even know you were back. What are some of the other questions that I get? Mm-hmm.
They'll say which, even though you can't direct care, but they'll say, well, which do you, what are other people using, or which do you prefer, what's a good,
Why is your product better?
Right.
yeah, combination, and why is this?
Right. The thing is with those, oh no, we got people coming.
Apologize.
That's my voice.
I think I can run outside really quick.
I'm trying to think of some of the other questions that I could ask.
Oh, but Dave's been active.
Okay, I have another one. Are we okay? Okay. Compounding with diclofenac. We're all very knowledgeable that diclofenac is an anti-inflammatory. It can be used for multiple different avenues. That's not good. Hold on. Back up. Okay. Let's see. How do I want to say this? Diclofenac is an anti-inflammatory that can be used to decrease inflammation in specific areas. Voltaren gel is the active ingredient, or Voltaren gel, no. I'm trying to say, help me. So, right, option, but how at different concentrations it can be used for migraines, for stress, tension headaches.
There are other uses for.
Okay. Diclofenac 1% is available in the marketplace. It's called Voltaren gel. We are able to do a diclofenac 4%, which the patient would apply 1 gram to the affected area 4 times a day. The pumps that we use will allow the patient to not have to measure out on a piece of paper 4 grams. One pump, one actuation will be 1 pump, which is 1 gram. Diclofenac also can be used at a concentration of 8.5 to 10%. We work with a neurologist who uses it specifically for migraines. So they will have the patient apply it to the temples, or they will use it for tension headaches, which is in the neck, and they will apply it to the neck, possibly putting a lidocaine in to just help numb and relax the area. I don't know what else.
I'm just trying to hit, every kind of one of the major categories. I'm trying to think of anything that you just helped Dave answer the questions. Was there anything with the podiatrist or something about how compounding can cover so many different
Oh, I know. I have a common one. In regards to scar creams, a commonly asked question is, how long do you have to wait to use a scar cream? So if there's been a wound, the wound does need to be healed. It usually takes 6 to 8 weeks. After the 6 to 8 time frame, then you can start using the scar creams to help decrease the inflammation, to flatten, take out the discoloration. Scar creams don't have to be used only strictly on new wounds. They can be used on old scars. An example is that we've had a patient apply it to a wound that was 7 years old. So it helped the keloid flatten. It also took out the discoloration. Well, Alexia, it was on her knee, and it was 7 years old. And it did help flatten it out and take out the discoloration.